So one of the things we've done is taken this you can see is another example of that kind of thing. The New York Times has done some great work in pulling together as much reporting as they possibly can across the country of reported COVID-19 cases and deaths. So you can see here, I think this is showing 1 week, yes, 1 week change in cases of COVID-19, and this is data that we're updating daily. So you can see folks at a national government agency or public health officials can take a look at a map like this and combine it with lots of different data on, say, the availability of hospital beds, things like that, where they can see where hotspots are starting to crop up. So you can see a few areas here around Louisiana, around Florida. We all, I think, are familiar with the sort of Northeast corridor, but you can see that Detroit, Chicago, some of these larger and even some of the smaller cities in the middle of the country are starting to see their number of cases skyrocket as well. Here's a specific example. We've heard local reporting from Chicago that very highly disproportionate numbers, they're seeing severe symptoms of COVID-19, including higher death rates among their African-American population than as a whole. So the statistic I pulled was that 70% of those who died from COVID-19 were African-American, whereas in the population of Chicago as a whole, it's only 30% African-American. So you can see there's something going on here, going on in Chicago. There is a recent CDC finding that shows that Black patients are disproportionately likely to need hospitalization from COVID-19 as well. So there's some kind of racial disparity. So what I've shown you here is a zoom in of Chicago. This is a map of predominant race and ethnicity in Chicago. So you can see some areas that are the sort of northern area, which is predominantly white. You can see 2 areas that are predominantly Black and another 2 that are predominantly Hispanic or Latino. So just kind of keep that in mind. Let's see. As you look at a map, at another map. So then we start to think about, okay, well, why would that be happening? Here's an example of one of the underlying health conditions that we know can lead to severe symptoms from COVID-19. You can see it's not only is it only minority neighborhoods, but is specifically the Black and African-American, predominantly Black and African-American neighborhoods that experience those high rates of hypertension, which the CDC also found folks tend to have bad results from COVID-19 when they have hypertension. And so then, you drill down further. Okay, well, why do we see that correlation between the Black community and hypertension? Well, there are a number of underlying factors that contribute there, but here's one of the possibilities. This is a map of low supermarket access in Chicago, where the darker purple areas are places where it's harder for people to get to a full service supermarket. So supermarkets that are larger and have more affordable fruits and vegetables and milk and whole foods like that. And you can see here, again, this is specific to the Black and African-American communities, not to the predominantly white or Latino communities. So that's an example. So I think there's a lot of attention on this at the moment. A lot of it is focusing on those underlying health conditions without really going that further step and exploring some of those inequities that are leading to those underlying health conditions, which are really just being exacerbated and highlighted by this new virus.